Hi, my name is Anjana Murali. I am a current MS2 at Pitt Med in the Physician Scientist Training Program.
So the training of a physician scientist is definitely different than like a regular physician. You have so much more like research intensive curriculums. You have grant writing classes, work in seminar or work in progress seminars. So how do you what inspired you to become like a physician scientist and pursue the MD but also pursue like this passion for research and science?
I think I was motivated to apply for the PSTP just because I did my undergrad at Pitt, and Pitt has such a great research focus, and we have such amazing PIs who are involved in so many different aspects of research that I was like, wow, like this could actually be a potential career for me. But when it came to applying to medical schools and figuring out what I actually wanted to do, I realized that I didn't feel like I had adequate research background to dedicate myself to like 4 to 5 years of a PhD. So I was really thrilled to see something like the PSTP exist, where I could complement my medical training with a year or maybe 2 years off to do research and explore my scientific interests.
Yeah, that's really awesome. So do you want to tell us a little bit about like a typical day here at the PSTP, or sort of kind of like how you balance the med school and then also like the research curriculum that you follow?
Yeah, so during the school year it's interesting because the PSTP isn't meant to draw away from your medical school training, so we only have mandatory class once a week for 2 hours, and it's a journal club, so we're reading research papers, both bench research and clinical research related to the topic we're covering. So, for example, last week we had 2 renal papers because we just started our renal block on an SGLT2 inhibitor and how that was identified, and a mouse model project related to that, and then a clinical drug trial on an SGLT2 inhibitor, which was just really cool to see that, like, wow, what we really do at the bench when it comes to research can be easily translated to the clinical side. Wow, and then we're learning about the kidney on top of that. So I feel like I have a really good understanding, or at least a good step forward when it comes to understanding renal physiology, because the PSTP complements my medical training so well.
Speaking of research, would you like to tell us a little bit about your research experiences and any interests you have like for your research here?
Yeah, so I was a little different coming to the PSTP because for most of undergrad I had done a lot of pediatric nephrology research. And I really enjoyed that. I had an opportunity to present at Kidney Week, which is like the biggest kidney conference in the country. And then I also got to publish a paper on my work. But then I came to med school and I was like, man, like I love the kidney. I still think it's the cutest organ, but I didn't know if I wanted to, still do research in the kidney because there is more to the human body than 2 cute little organs. And so I did some self-reflecting, and I realized one of my favorite projects in my kidney lab was related to metabolism of the nephron progenitors. And I was like, like metabolism is great because every organ system needs it. And I met with the chief of endo at Pitt, who's Dr. Kershaw, and she's a phenomenal woman, one of my role models for sure. MD only chief of endocrinology and has a fantastic research lab. And I was like, so this is really possible. I could really just be trained as an MD, definitely put in that hard work to get the research training background and figure out how to write grants, and I could run a lab potentially and maybe even be chief of a division one day. So that was my first PSTP rotation, was with Dr. Kershaw. And we were investigating a novel obesity risk variant gene that she had helped find in the American Samoa population.
Oh, okay.
And so it's just interesting because so often we talk about obesity as something that is based on diet and physical activity, which are definitely big components, but as someone who studies rare lipid disorders, Dr. Kirsch's like, there has to be some big genetic component. And so this founder population in the American Samoa was perfect for figuring out if there was a risk variant gene, and there is. It's called CRUBRF. So my first summer I spent kind of characterizing the CRUBRF model in our knock-in and knockout mouse models. And then this summer I decided that I wanted to stay in endocrinology, and I actually just jumped one laboratory over to Dr. Jerzak's lab because he does a lot of really cool physiology with insulin resistance. And one of the projects that I got to work on this summer was related to non-alcoholic fatty liver disease. I don't know if you've heard about it, but it's essentially a condition where fat accumulates in the liver and causes a ton of metabolic disorders as a result of it. And so we had come up with a project where we were looking at something that could potentially reverse NAFLD and reverse the onset of the disease and potentially slow down its progression to a state of steatohepatitis. So I officially decided on joining the JERSAC lab. So I'll be studying NAFLD for my research year.
That's so exciting.
Yeah.
Well, congratulations. All right, so talking about this, a lot of, I think, undergrad students come in to pay, they want to do this research, they have such excitement for it, and then it's really hard to find like good research experiences, good PIs, and they kind of lose that interest. So do you have any tips for finding good research places, good positions, and good PIs to guide you through your process?
No, that's definitely a valid concern because I feel like with so much of research, at least for me, I've loved a lot of the research projects I've been a part of, but I feel like some of my big draws to a research lab are the mentor and the project I'm working on, because your mentor kind of shapes how you think about research, how you want research to be part of your career, if that is something you want to do. And so my biggest tips are go in and talk to that mentor, and also go and meet the other lab members, because as much as a PI can dictate how well you do in a lab rotation, the lab members are the people you work with on a day-to-day basis. And so make sure you can get along with them, make sure that the people are doing projects that you would be interested in, and also techniques that you want to get better at or want to learn for the first time. And then something specific to a mentor, I think, is making sure that they have time for you and time for you to meet with them, to ask them questions, that they're willing to give you feedback.
Yeah,
because some mentors can be really busy, and then if you're somebody like me and you just kind of need that mentor contact on like a day-to-day basis, or a couple times a week, it's not ideal to work with a mentor who's like not always there. But for somebody who has like more of research background, they're like, I'm good, I can run on my own for a couple of weeks and just check in with a mentor. Somebody who's not around as much is probably excellent for them,
Yeah.
So it's definitely nuanced to an individual's preference. And then the other thing I think is making sure that you can talk to your mentor about guidelines and how you want your lab rotation to go. So make it kind of clear at the beginning of your rotation on, like, hey, my goal for the end of this rotation is to present a poster. Maybe do you think if I worked hard enough I could write a review or write up a paper on like what we had worked on? So once you set those expectations and you feel like you have a good line of communication with your mentor, those are all just strategies for success.
Yeah, definitely. Thanks for sharing. Yeah, it's definitely very helpful. What are some like shocking discoveries you found out that a physician scientist does or is part of their lifestyle that you didn't know when you first joined this program?
Shocking discoveries. I think I was just surprised to find so many MD-only physician scientists who run amazing labs and are doing tremendously important research, because for so long I thought you needed a PhD, extensive research training to get that far. But it turns out doing well in research depends on the person and having that spirit to like, persevere through failed Western blots, running the same qPCR over and over again. It like comes down to the individual having the resilience to want to do research and having, enough research training to know that you like this career, and of course the writing skills and the presentation skills to present the work that you've done and to get money for the work that you hope to keep doing. And so once I realized that was just a common trait amongst all physician scientists, I think it kind of eased my tensions on like whether or not I could make this as a potential career. But another, I think, shocking discovery was the fact that physician scientists have normal lives outside of the hospital, which is also another breath of relief, because as someone who has like clinical time, and then you also have time for your research, and then you also want to be a good mentor for your future mentees, you're like, how in the world do you have time for your own hobbies or your own family if that's something you want? And so something that the PSTP does well, I think, is your first summer in those once a week, like research training classes, we meet with different physician scientists and we ask them, like, how do you split your clinic research time? What do you do for fun and how do you fit that in? And if you have a family, how in the heck do you manage like having a family, being there for your kids, and also having this like extensive career? And they've all just come up with such incredible ways that they've made this work-life balance happen for them.
That's really awesome.
So it is like really nice.
So after like a long day of lectures and exams and the general stress of being an MD student, what brings you back to Scaife Hall every morning?
I think something that I like had to learn through the med school process was that as important as it is to like work on that output of, you know, like doing all exams, learning as much as you can, writing your research grants and whatnot, there's not as much emphasis as I think there should be, but something equally important is taking the time for yourself and de-stressing after a long day and self-reflecting and doing things that make you happy, because at the end of the day, the only way you can be a good physician is if you yourself are a happy, confident physician. So I meet up with friends for dinner, or I go on runs with a lot of friends because it's physical activity and catching up with people all at the same time. I watch TV or read a book when I go home for an hour or two, just so that I can get back into the study mode, go to bed happy, and then wake up and come to Scaife the next day.
Yeah, so sounds like a pretty good plan.
Yeah, wellness is really important. I think it's something we don't talk about often enough, but it's just as important as studying hard and doing well on your tests.
Yeah, definitely. I think being an undergrad, just graduating from college and everything, definitely you have all these open avenues, you know, you don't know what to explore, but then also being like a pre-med student, maybe like a PSTP hopeful student, you have to like think of that commitment and what you want to achieve in your life. And if you want to commit yourself to like this is even longer than the regular MD program, right? It's 5 years long. So what are some important factors that you think that these students who want to be a part and commit themselves to these programs should think about before they start embarking on this journey?
This is going to sound like a little counterintuitive, but I think I would just suggest that people be open-minded about what they want to do as a career, because I think I came into med school with kind of like a focus. I was like, my whole life, I think I've wanted to be a pediatrician. I love working with kids. I like coming up with these lesson plans. So like a pediatrician sounds pretty good to me. But people told me, you know, keep an open mind. You don't know what you're going to like. And I came to med school, and right off the bat, you start interviewing standardized patients. So people who are volunteers, but they're trained to act like patients in different scenarios. And you have to interview them and do physical exams on them. So you get to know these people very well. And they embody the persona of a patient extremely well. So you feels like you're in a simulated hospital encounter. And I realized through those experiences that like maybe I don't want to work with kids. Maybe I do like adult medicine a little bit more. And then in each of my organ blocks and classes, we just finished cardio, and I loved it. I never thought I was going to be a cardiologist. And I was like, maybe I'm going to be a cardiologist. I called up my parents and I was like, guys, like I think I'm going to be a cardiologist. And they're like, okay. And then we started renal. It's like, oh my God, this is like bringing flashbacks of like the phenomenal time I was undergrad doing kidney research. And I love all of our renal professors. And I was like, hold that thought, I think I want to be a nephrologist. But now I'm like, man, if you just go in with an open mind and love everything that you are learning and absorbing in medical school, you realize that this is what we all wanted to do for such a long time, and all of it is incredibly fascinating. And so as I go through this whole process, I'm like, well, now I don't know what I want to do, but I'm fine kind of living in that ambiguity, because we don't need to make that decision for a long time.
I think it's a very important factor too, to like learn how to live in that sort of, I guess, continuum.
Yeah, no, it's definitely hard, because as a pre-med undergrad, I had a plan. I had a plan on how I was going to get to med school, what residency I was going to go to, I thought, and how I wanted my life to be. And so it was a hard adjustment, but something that was definitely worth taking the risk and being open to whatever opportunities come your way.
Yeah, definitely.
Yeah.
All right. Well, that's all the questions we have today. Thank you so much for coming here, giving us your time, and educating us on the physician scientist training program. I'm sure it'll be really helpful to our hopeful readers.
Yeah, of course, it's my pleasure. I hope more of you join the PSTP. It's a phenomenal program.